When you think about Cuba, what do you think about? A lot of people think about old cars, cigars, and impoverished people, but there's so much more to learn. In 1960, after the rebels were led by Fidel Castro and the Batista regime, the U.S. placed an embargo on exports to Cuba except for food and medication. This embargo was caused by the nationalization of oil refineries. In 1962, President Kennedy and the Congress approved the Foreign Assistance Act. This prohibited any trade with Cuba, including medical advancements. Without U.S. technology, the Cubans had to change the way their health care worked. Universal health care became top priority and an Institute of Preventative Medicine was created. So how does the Cuban healthcare system work now?
We wanted to learn more about the Cuban healthcare system, so we sat down with Peter Barris to discuss what we can learn from them. Peter has gone to Cuba several times and has an expert opinion on the matter.
In this short clip, a reporter from CNN, Sanjay Gupta, explores the preventative healthcare approach of the Cuban people.
A lot of the focus is on prevention. That's because it's easier to prevent disease and cheaper than to treat them. So there are screening programs starting at a young age for vision and for hearing. There's also a very robust vaccination program. But keeping track of 11 million people on the Caribbean's largest island often requires a personal touch.
Preventative health care is when disease prevention is favored over disease treatment. The belief is that diseases begin before we realize them. According to the CDC, in the United States in 2012, half of all adults had one or more chronic diseases. Cuba has also eradicated the transmission of HIV from mother to child. Cuba has a national immunization program. This made vaccines free of charge. Cubans no longer die of infectious diseases. As of 2012, there are 33 vaccines produced in Cuba.
In 1988, the Cubans were the first to develop the meningitis B vaccine. Because of the embargo, this vaccine was not available to the United States population.
The Cuban government spends $431 per person per year, while the United States spends $8,550. Cuba has a similar life expectancy and a lower infant mortality rate than the United States.
The training of physicians differs from training in the U.S. because students in Cuba go directly into medical school right after high school instead of attending an undergraduate program prior. They also don't have to participate in residency in Cuba before going on to pursue their practice. Here's a clip of Peter's insight into the medical training of doctors in Cuba.
The medical educational system is considered to be world-class and so good that the University of California Medical Association will accept a medical degree from Cuba and allow those students to sit for medical exams under their own umbrella. And Cuba is the only country in the world where their medical graduates are accepted so easily into the American Medical Association.
Healthcare in Cuba is free and universal, and it is enshrined in the Cuban Constitution as a fundamental human right guaranteed by the state. If any Cuban citizen is in medical need, their healthcare costs are completely covered by the government.
It means that everyone has access to a physician and to healthcare resources, regardless of who they are, regardless of what their status in life is, regardless of where they live geographically, regardless of what their healthcare issue is, their problem is, or their need is. So everyone has access. The system is set up to make that access very easy because it's built on a neighborhood system of healthcare, made easier in Cuba than any other country I've observed, and prevention has been the hallmark of their healthcare system from the very beginning. The presumption is, or was, that if you're a poor country without a lot of resources, without a lot of technology, and under some siege by the United States of America, that you have to deal with the issues, health issues, before they occur rather than try to deal with them after the fact.
Cubans are now living longer, and they are developing diseases that richer countries tend to have. They are now trying to use public education about tobacco usage, diet, and alcohol consumption to lower the rates of diseases that are related to these poor habits.
They lack a lot of medications that should be available to any population, any country. Partly because we won't sell certain things to them,